will have a question and answer session. If you'd like to ask a question, please press 1, then 0. I'd now like to turn the conference over to Supervisor Hilda Solis. Please go ahead.
Thank you. Buenas tardes. Good afternoon, everyone. I'd like to thank you for joining us today at our daily press briefing. I'm Hilda L. Solis, Chair Pro Tem of Los Angeles County Board of Supervisors. And I'd like to first reflect upon the nationwide protests and civil unrest that we have seen take place this past week. I have thought about George Floyd and his family, about Breonna Taylor and Ahmaud Arbery and their families, and about the Black lives that have been taken over the years due to unabated and unaccountable police violence. Black communities are once again grieving, and our country is collectively grieving. The protests that have swept this United States are in direct response to the injustices Black communities face every single day. I want to be clear that I stand with the peaceful protesters who are fighting the Black lives and justice for communities of color everywhere. Now more than ever, we need a change. We need accountability, and we need justice. This is, of course, a public health briefing on COVID-19. But now we've seen another public health crisis highlighted. According to the National Public Health Association, addressing law enforcement violence should be a public health priority. And as Dr. Barbara Ferrer has said, the root cause of health inequities, especially during the pandemic, is systemic racism and discrimination. And I want to ensure that during these increasingly difficult times, everyone stay connected with family and loved ones. Our lives have changed abruptly, which is why it's so important to take care of our mental health. It's okay to ask for help. And if you or a loved one needs support, please contact our LA County Department of Mental Health helpline by calling 1-800-854-7771 or texting LA to 741-741. We do have to recognize that the civil unrest has impacted many small business owners, many of whom were already struggling to stay afloat in light of the economic impacts of COVID-19. Many of these business owners come from our communities, and their businesses fuel our economy and provide much-needed jobs that support countless families throughout our community. 1 in 3 Angelinos are immigrants, and 1/3 of LA County's $700 billion economy is attributed to them. 2/3 of what we call Main Street businesses in LA County are immigrant-owned and run. The county will do what we can to identify resources and aid to our impacted businesses to help them recover. And if you own a business and would like to learn more about these resources, please visit lacountyhelpcenter.org or call 800-593-8222. We just learned that the national unemployment rate has dropped to 13.3% in May from 14.7% in April. But I want to emphasize that this is still much higher than the peak of 10% unemployment during the Great Recession over a decade ago. In fact, Los Angeles County has had a peak unemployment rate of 19.6% in April of this year. And moreover, a total of 1.6 million LA County residents have filed for unemployment insurance claims in the 3 months that we have been dealing with this crisis. We know this is hard-hitting for our communities, and the hardest particularly hit are those people of color. Whereas the national unemployment rate for white people went down from 14.2 to 12.4%, the unemployment rate for blacks ticked up from 16.7 to 16.8%. And for Asian Americans, it rose from 14.5 to 15%. And for Latinos, unemployment dropped slightly, but still remains at 17.6%. So as we continue to reopen our economy, we hope to provide some relief to those who can get back to work right away. I want to remind everyone that we are also needing to continue to work to stop the spread of COVID-19. As some businesses and our public spaces reopen, we must follow the health guidelines. This is for the safety of all our county residents. I want to thank everyone for your cooperation, and now I would like to introduce Dr. Barbara Ferrer, our Public Health Director.
Good afternoon, everyone, and thank you so much, Supervisor Solis, and to the entire Board of Supervisors. These are indeed challenging times, and we're grateful for your leadership and especially for your deep commitment to economic and racial justice. I want to start by updating everyone on our current status. I'm sad to report 36 additional people have died from COVID-19. 25 of the people who died are over the age of 65, and 22 people who are over the age of 65 and passed away had underlying health conditions. 9 people who died are between the ages of 41 and 65, and 6 people in this age group had underlying health conditions. And there's 1 younger person who died between the ages of 18 and 40, and they also had underlying health conditions. Information on the 1 death reported by the City of Long Beach is available at longbeach.gov. 12 of the 36 people who passed away were residents at our skilled nursing facilities. This brings the total number of deaths to 2,565 across LA County. And the loss of our neighbors, friends, and loved ones across many neighborhoods is felt by all of us, but particularly by those who are mourning. And we share your grief. You're in our thoughts and our prayers every day. 94% of people who have died from COVID-19 had underlying health conditions, and this number has stayed consistently very high. So it continues to be important for people with underlying health conditions to stay home as much as possible, even during our recovery. Please continue to avoid close contact with others, and if you have even mild symptoms, call your provider immediately. If you need a provider, please call 211 so that you can get information on a provider that's in your neighborhood. Today, we're also reporting 1,445 new cases, and this will bring the total number of people who have tested positive for COVID-19 in LA County to 61,045. The 61,045 total cases we're reporting include 2,160 total cases reported by the City of Long Beach and 968 total cases reported by the City of Pasadena. Both cities have independent departments, health departments. I do want to remind everyone that it's important that we continue to expand our access to testing for those who need to be tested. And as long as we are testing a lot of people who need testing in LA County, we should expect to see our case numbers to go up. And as I've said before, that's not a bad thing. When somebody is identified as being positive for COVID-19, it's an opportunity for them to know that they need to isolate themselves, and for us to know at the Department of Public Health that we need to contact them and all of their close contacts so that they stay out of circulation and cannot expose others in the general public. If people don't have access to testing, it's very hard to actually be able to contain the epidemic. So I just want to reiterate that I'm so grateful to Dr. Galley and her team for making sure that we've improved access to testing across the board. We're also reporting today 447 confirmed cases among people experiencing homelessness. 201 people who were experiencing homelessness were sheltered, and they have been appropriately isolated, and their close contacts are quarantined. I am sad to report that 2 additional people experiencing homelessness have passed away from COVID-19. Both of the people who died were unsheltered, and this brings the total number of deaths among people experiencing homelessness to 13. And to the family and friends of the people who experienced in homelessness and passed away, we're deeply sorry for your loss. There's 6,833 people who have tested positive for COVID-19 that have been at some point during their illness hospitalized. And this has now dropped to 11% of all of our positive cases. Currently, there's 1,488 people who have a confirmed case of COVID-19 and are hospitalized. 29% of the people are in the ICU, and 20% of the people are on ventilators. This has been a slight increase over the last 3 days in the number of people that are hospitalized, and we'll need to continue to pay a lot of attention to this to make sure that we're not starting to see a significant increase in the number of people requiring hospitalizations. We have investigated a total of 564 residential congregate settings and non-residential settings with at least one confirmed or suspect case of COVID-19. Of these, 484 are being currently investigated, and there are 80 institutions where we've closed the investigations. These settings do include nursing homes, assisted living facilities, shelters, treatment centers, supportive living, correctional facilities, workplaces, food and retail, and educational settings. And while the numbers are still small in terms of workplace outbreaks, we have seen almost a doubling of our investigations at workplaces over the last 3 weeks, again, as more and more people have been going back to work. The total confirmed number of cases in institutional settings is now 14,519, and this includes 9,449 residents and 5,070 staff members. I'm also sad to report that 1,379 people who were living in institutional settings have died from COVID-19, and 89% of the people who lived in institutional settings and passed away resided in our skilled nursing facilities. Our deepest condolences go out to the families and the friends of the people who were residing in our nursing facilities and passed away. And I will be updating you in a moment on the work we're doing to try as hard as possible to ensure the safety of both our residents and our employees at our nursing homes. We're also reporting 954 confirmed cases at some point in time in the jail facilities. 712 cases were among people who are incarcerated, and 242 were among staff. There are 178 cases in the state prison, 128 among people who are incarcerated, and 50 among staff. And there are 753 cases in the federal prison facilities, 738 among people who are incarcerated, and 15 among staff. We now are reporting 26 cases in the juvenile facilities. This includes 11 among youth and 15 among staff. That's an increase of 1 from the last time I reported. You can find information on confirmed and suspect cases by facility, as well as a dashboard on testing, case and death data, and our recovery dashboard when you go to our website, publichealth.lacounty.gov. The Los Angeles County Sheriff Department is reporting 307 positive cases among their staff, 398 staff who are quarantined, and 1,616 staff that have been able to return to work. The LA County Fire Department is reporting that 515 staff members were tested for COVID-19, 31 staff tested positive, 11 are isolated at home, 30 have returned to work, and 3 are still home sick. I want to thank Sheriff Villanueva and Chief Osby for sharing this information with us every day. Sorry. Over 671,000 COVID-19 test results for individuals have been reported to LA County Department of Public Health. And the cumulative total of percent of people who tested positive is 8%. But over the last 7 days, our positivity rate has dropped to 4.4%. Again, indicating that while we have a lot of people getting tested, only about 4.5% of them at this point in time were tested positive. I do want to note that there are appointments available at the regional testing sites, and you can find the testing sites and make an appointment when you go online at covid19.lacounty.gov/testing. I do have a few updates today. First, I want to provide you with an update on our efforts at the county's skilled nursing facilities. As of yesterday, 244 skilled nursing facilities have tested all of their residents and their staff, and an additional 71 skilled nursing facilities have been scheduled or are in the process of conducting their testing. This includes facilities that have had outbreaks and facilities that have not yet had any outbreaks. And I want to note that the testing is a collaboration between Public Health, the Department of Health Services, LA City, and the nursing facilities. And we're very grateful to all of our partners in this work. Of the over 18,000 people that have been tested where we already have their results, 9% tested positive for COVID-19. Only 14% of the people who tested positive were symptomatic. This is true for both residents and staff. So 86% of the people in these settings that tested positive were either asymptomatic or pre-symptomatic. And as a reminder, part of this is because we test all the time in these facilities, particularly people who are symptomatic, and when they test positive, they are dropped out of these results because we already had their results. These rates are very similar to the rates that we reported about 2 weeks ago. The low number of symptomatic people does suggest that while some may be pre-symptomatic, there's a high degree of probability that there are, in certain settings, significant numbers of people that are positive for COVID-19 without any symptoms. And this is why distancing and infection control practices are so important, and why we continue to work hard with all of our partners to ensure that these facilities are as safe as possible for residents and staff. I also today have an update on race, ethnicity, and income level data that we're collecting and looking at closely to understand how COVID-19 is disproportionately affecting some groups. For the 2,373 people who have passed away where race and ethnicity data has been identified, 41% are Latino or Latinx, 28% are white, 18% are Asian, 12% are African American, less than 1% are Native Hawaiian or Pacific Islander, and 1% identified with another race or ethnicity. When we analyze these numbers as rates per 100,000 people, we're able to make comparisons with other groups across the population, and this reveals more about which groups are disproportionately affected. The death rate for African Americans is 31 deaths per 100,000 people, and for Native Hawaiians and Pacific Islanders, the death rate is 30 deaths per 100,000 people. For people who identified as Latino Latinx, the death rate is now 29 deaths per 100,000 people. For people who are Asian, the death rate has also increased to 21 deaths per 100,000 people. And for our white residents, the death rate is 15 per 100,000 people. And when you look at this data by community poverty levels, we see that people who live in areas with high rates of poverty have almost 4 times the rate of deaths for COVID-19, 51 deaths per 100,000 people, compared to communities with very low poverty levels where the death rate is 13 per 100,000 people. We also now are analyzing our data to predict how many deaths we should expect to see from COVID-19 if every group has the same death rate as those who have the lowest rate of death. We call that the reference group. We can then calculate how many additional deaths have occurred beyond what we would expect, and we call this excess deaths. When we look at excess death information by race, ethnicity, and income, it paints a very disturbing picture. If the death rate for all groups were the same as it is for white residents, who have the lowest death rate, we would have 754 fewer deaths. This means that there were 485 excess deaths among people identifying as Latino Latinx, 143 excess deaths among our African American community, 125 excess deaths amongst people who identified as Asian. And when we look at communities by income levels, and we assume the death rate for all groups could be the same as it was for people living in communities with little poverty, there have been 981 excess deaths among people who live in communities with higher levels of poverty. These numbers are absolutely devastating and represent real people whose lives have been lost. They also starkly show how inequities have a life and death consequence. We continue to work with our community partners and the Department of Health Services on closing these gaps and providing more resources in under-resourced communities. One such effort to increase resources has been around testing. As of today, there are 73 COVID-19 testing sites that have been stood up. This includes sites at CVS pharmacies, hospitals, local community clinics, and other community sites, and many have been located on highly impacted communities. We urge people who need to get tested to please make an appointment. Visit covid19.lacounty.gov/testing so that you can find a location near you and make an appointment. Our sister departments and partners have also continued to offer services that are related to our safety net: food, housing, and other supports, including mental health supports. And I encourage you to visit the covid19.lacounty.gov website for more information. The very real impact of the injustices plays out every day with the news I share with you and amplifies why racism is a public health issue. And the disproportionately higher number of deaths from COVID-19 among Black and brown people is an indication of the impact of racism and discrimination on health and well-being. And as I have mentioned, this results in a higher rate of death and disability for almost every cause for, again, communities of color. It starts at the beginning of life when Black babies are 3 to 4 times more likely to die before they reach their first birthday, and at the very end of life when Black residents die on average 6 to 10 years younger than all others. We must look at the structures, systems, and practices in our society to understand the root cause of these inequities, which really have much to do with a long history of institutional racism. And that's resulted in and continues to result in fewer resources and opportunities that are needed for optimal health and well-being. I want to thank everyone who's been on the front lines for this last week, standing to end racism and oppression. I do also want to talk for a minute about the risk of exposure to COVID-19 while you're in any large gathering, whether that's on the boardwalk in Venice or joining a protest against racism somewhere in our county. If you think you may have been exposed to COVID-19 while you're out and you're in large crowds because you were in close contact for at least 15 minutes with people who were not wearing face coverings, please remember that this virus has a long incubation period, and it will be important for you to remain away from others as much as possible for the next 14 days. And it's also important to recognize that if you do get tested right away after you think you've had an exposure, you're likely to test negative because your viral load will be too low to be detected yet on a test. And testing negative for COVID-19 after you've been exposed does not mean that you can't become infected later during the incubation period. So we ask, even if you tested and were negative, you still need to remain away from others for 14 days after you've had your exposure. If you're living with people who are at greater risk of becoming seriously ill from the virus, it's particularly important that you maintain 6 feet of distance and you wear a face covering even while you're with them at your home. Avoid preparing any food for others, avoid sharing utensils, bedding, and towels, and increase cleaning and disinfecting of any common surfaces. If you do develop symptoms within 14 days of exposure, please contact your healthcare provider to connect to care and testing. While testing capacity has increased across our county, and we're very grateful to Dr. Galley and the Department of Health Services for their hard work in making this possible, there still remain priorities in who needs to get tested. Our highest priority groups for testing continue to be patients who are hospitalized, healthcare workers, and first responders with symptoms, as well as residents and employees, both symptomatic and asymptomatic, in long-term care facilities or other congregate living facilities where there are outbreaks. These groups are prioritized in order to ensure optimal care and lower the risk of spread of an infection in either a hospital or an institutional setting. We also strongly encourage testing for anyone who has symptoms and is older and has underlying health conditions, or has underlying health conditions. As we mentioned every day, these groups are at greater risk for very serious illness and death from COVID-19. We encourage testing as resources permit for any person who's experiencing symptoms, as well as for people who have been close contacts of people who are positive or are suspected of being positive for COVID-19. I want to note that as we go into the weekend, we do continue to ask of everyone, since you are out and about more, that you please take this as an opportunity to respect others and take care of others by wearing your cloth face covering whenever you're in close contact with anyone and keeping your distance as much as possible. We do need to continue to take these actions so that we can prevent other people from becoming infected with COVID-19. These actions are the kind thing to do, and they save lives. Thank you. And now we will go to Spanish. Oh, sorry. Now we'll go to Dr. Galley from the Director of Health Services.
Hi, good afternoon. I'm Dr. Christina Galley, the Director of the Department of Health Services. I'll touch on 3 topics today: disparities in how COVID-19 is affecting certain communities, especially communities of color, testing for COVID-19, and particularly in response to some of the protests and new testing guidance that the Department of Public Health has put out that Dr. Ferrer just went through, and an update on the hospital modeling projections indicating how COVID-19 is spreading through our communities and the impact that it might have in the future on the hospital system. First, on the disparities. Unfortunately, as with many injustices that we're fighting right now, COVID-19 is showing that it's tragically impacting certain communities disproportionately. Dr. Ferrer just went through the data, and it's striking. Communities of color are having higher case rates and higher death rates from COVID-19, and this is due to the long-standing structural and systemic racism that is apparent in multiple aspects of our society. The county, across the county, multiple departments, including DHS, are doing everything we can to respond. At DHS, we're committed to ensuring that equity and access to health care is there for everybody, regardless of the color of their skin, where they were born, their immigration status, their income level, their coverage or insurance status. DHS is already the medical home for 450,000 individuals, virtually all of whom are covered by either Medi-Cal or are uninsured and not eligible for any coverage. More than 80% of our patients self-identify as being an individual and person of color. High-risk populations that are heavily impacted by COVID-19 must have access to testing and medical care within their communities in a geographically accessible way with a provider that they trust. DHS has taken this geographic focused approach in setting up and supporting testing sites in a way that ensures equitable and sustainable access across the county's communities. As we work to integrate testing into the healthcare system, we're working with providers in these communities that individuals know and trust, whether those are DHS clinics, federally qualified health centers, or FQHC lookalikes, or other clinics and providers. People in at-risk communities can come to any testing site in the county, or they can go to any one of a number of DHS clinics or FQHCs that serve and provide testing services or that are starting to provide testing services. We are also working with a variety of clinics to help support their ability to be able to ramp up testing of their own patients. We're providing technical assistance in a variety of ways, connecting clinics to laboratories if they don't have existing contracts that have sufficient capacity to be able to meet the demand for tests, providing communications and outreach support, leveraging state supplies of personal protective equipment and swabs, test kits, and reagent and viral transport medium. Obtaining assistance with payer, claiming, and reimbursement processes so that the health plans who are the rightful payer of the services can be billed appropriately, and are working in partnership with the Department of Public Health on an approach to contact tracing that leverages these community-based organizations and community clinics and can be responsive to the local needs of the communities. Even with access, we know that we need to do everything we can to support and continuously engage high-risk communities. This is key to being able to provide trusted and ongoing continuity of care in a clinical environment. We are exploring opportunities for sustainable community-driven outreach in highly impacted communities in collaboration with clinics and other key community stakeholders. As one example is the county testing site at the Charles Drew University campus in South Los Angeles. This operates as a partnership between a DHS clinic, the Martin Luther King Jr. Outpatient Center, and Charles Drew University. Test site workers from the MLK Outpatient Clinic provide the actual testing services on site in partnership with others and connect those to medical care either at MLK or at other clinics wherever the patients receive their care. Staff from Charles Drew are actively engaging in outreach across the community, including canvassing local groceries and community-based organizations. The efforts by these CDU outreach staff have significantly increased the daily testing volume that this site has seen, from initially 100 to 200 per day to up at over 700 tests per day. This is a model that we're very proud of and that we can follow as a successful community-based approach to testing and outreach. To further support this type of work, DHS is submitting a proposal for $4 million in funding from the CDC's Epidemiology and Laboratory Capacity Grant to help address disparities. This will include funding to support communications campaigns in highly impacted communities, incorporating culturally and linguistically appropriate public education materials, working on community outreach and engagement and linkage to care initiatives to address disparities in access to COVID testing and medical care. This includes focus on a variety of at-risk populations, including Black, Latinx, Asian and Pacific Islander, Indigenous, monolingual, and justice-involved populations. We're also working and seeking funds to support organizational capacity building within multiple community providers that are, again, well integrated into these local communities and are trusted organizations, working to enhance their capacity to improve outcomes among communities' most vulnerable residents. In tracking race and ethnicity to this point, we're very pleased that communities of color are accessing testing services across the county's drive-through testing services in a manner that's proportionate to the overall population. But given how the death and case rate is disproportionately falling on these at-risk communities, we need to do more. Everyone, especially those who are at risk of serious outcomes from COVID, should know the symptoms, should have access to a convenient test site where they can receive a test if they need one, ideally one that's connected with their provider who can continue to follow them and check in on them and make sure that they're getting access to care within a hospital setting if they need it. I also want to comment briefly on testing access this week in light of the protests. It is inspiring on many levels to see the desire of many Angelenos who are engaged in peaceful protests in response to the unjust killing of George Floyd at the hands of police, and in protest of the many factors that have made these events tragically common. As the protests took place, the county did not issue a mandate for any test sites to close. Rather, we allowed each testing site to make its own decision as to whether or not they felt like they needed to close or adjust their hours and close early based on what was happening in the local community, based on protest schedules or the needs and desires of their staff. As a result, we did see the volume of testing across this week decline slightly, and that's due to several factors. Both the fact that at the same time a few test sites were closed, these were independently operated sites that chose to close that was unrelated to the protests. Sites also that did elect to close in response to the protests or the curfews naturally led to some cancellations, and we did outreach to about 2,000 individuals to work to cancel and let them know how they can reschedule their appointment. We also saw higher than usual no-show rates at test sites across the county, even when appointments were not canceled. And we felt like this was understandable given everything else that was occurring across Los Angeles this week. Access to testing is still a top priority for the county. DHS is continuing to work with our staff, our partners, and the broader healthcare system to ensure we're able to provide testing for all those who need it. Our success is shown in the state's numbers, where Los Angeles has one of the highest testing rates of all counties across the state. Slots remain at all of the sites across the county, and individuals can access those through the COVID-19 county testing website. At all of the county-operated and partner-run sites, we're committed to providing the highest quality testing product possible. We are aligning with labs who can deliver improved turnaround times. We're also shifting from an oral collection swab mechanism to a nasal swab. This is a swab of the front of the nose. This is very different than sometimes what people hear about of a nasopharyngeal or an NP swab, which is the back of the nose. This is still self-collection. It does not require collection by a healthcare worker, but as per the current practice, healthcare workers will be on hand to advise and help assist as needed. While oral approach was effective, multiple studies, have shown that a switch to the nasal swab is better and leads to a better specimen collection, better sensitivity, and will lead to fewer false negative test results. This is key in our long-term testing strategy as we work to limit the spread among various communities. Also, as Dr. Ferrer just mentioned, the Department of Public Health has put up new testing guidance on their website. This guidance highlights the ongoing need for all symptomatic individuals to be tested so that they can be appropriately isolated and also their contacts can be traced. The guidance also highlights the need for close contacts of known cases as part of public health's contact tracing efforts to be tested. Alongside continued testing is those who live and work in high-risk congregate care settings, such as skilled nursing facilities, or who are working among persons experiencing homelessness, and these testing outreach efforts are continuing. The guidance also clarifies that beyond these close contacts and high-risk settings, asymptomatic individuals do not generally need to be tested. The guidance reiterates that testing also should not be used to end quarantine or isolation early. This guidance will be implemented in the coming weeks at our testing sites as we work on the specific plans in partnership with DPH. I'll shift now to providing a brief update on the DHS modeling effort. My thanks to Dr. Roger Lewis and his team for all of the work in continuing to produce this data on a weekly basis. The overall volume of hospital-based care for patients with COVID-19 appears generally stable or slightly uptrending. Over the past few weeks, we've spoken of the R, or the effective transmission rate. After the introduction of the Safer at Home health officer orders, the R fell rapidly from initially around 3 to 3.5 to around 1, meaning that for every case of COVID-19, it was passed on to approximately one additional person. While we don't know precisely yet how reopening and the recovery activities will affect transmission of COVID-19, R does appear now to be greater than 1 and slightly uptrending. If transmission has indeed increased, then the model predicts that we will have a continued increase in hospital patient volume over the next 2 to 4 weeks, and we would anticipate beginning to see that change happen over the coming 1 to 2 weeks. Even with this trend at greater than 1, the number of hospital beds and ventilators in Los Angeles County appears to be adequate to meet the projected need for the care of COVID-19 patients over the next 4 weeks. The number of ICU beds may become inadequate in 2 to 4 weeks based on the currently available number of beds that are provided in daily hospital polls among the public and private hospitals. DHS and its EMS agency is watching this availability of ICU beds very closely. The data are also continuously updated on a daily basis and posted on the DHS website in our daily bed capacity dashboard. We must all do everything we can to keep the R from continuing to increase. This includes the basics: washing hands, cloth face coverings when you go outside or around others that aren't in your family, continuing with physical distancing and separating yourselves from others by at least 6 feet wherever possible, and following diligently all of the quarantine and isolation orders, regardless of whether or not you were tested and regardless of whether or not you tested negative. There are ways to maintain these practices even as we re-enter society and get people back to work, something that is critical for all of us to do. Please continue to do everything you can to follow these core public health practices. Your actions, my actions, have an impact not just on our own health, but the health of all of those around us and all of those that we interact with. We are all in this together. We can all get through this, but only by each of us doing our part. Thank you for all of the continued work of the first responders and the healthcare workers, for being on the front lines and serving those with COVID, and for everything everyone is doing to help reduce transmission and keep us all safe. With that, I'll turn it over to Ryan for questions. Thank you.
Okay, once again, if you do want to ask a question, please press 1, then 0. Our first question is going to come from the line of Dave Lopez with Channel 2 News. Please go ahead.
Hi, Dave.
Yes, good afternoon. Following up, Dr. Galley, on the increase in the R, that is before any of the demonstrations took place. Was this something